Please join me in welcoming Dr. Wazzan.
السلام عليكم جميعا صباح الخير بسم الله الرحمن الرحيم والصلاة والسلام على سيدنا محمد وعلى آله وصحبه أجمعين. Rahaf, this is my daughter. She was 6 years old when her mom was telling me she's wetting her bed. This was 10 years back. And I kept on telling her, no, that's okay. Then eventually, a few days later, she told me she is vomiting. And I was wishing that nothing is going wrong with her. And I told her if she starts passing stool or diarrhea, means it's gastroenteritis. Now, another day, Rahaf, in the morning, she woke up quite ill. I told her, Mom, let's take her to the hospital. When we took her to the hospital, we found out she was a DKA case with a newly diagnosed diabetes. Who was the late person who diagnosed Rahaf? Her dad, me. So this is important, and it goes completely in the context of our case. In this discussion, we'll ask 3 questions, and by the end, we'll have 3 answers, inshallah. We'll ask what, why, and how. If we talk about diagnostic safety, it has 3 components. The first one is accuracy. When we talk about diagnosis, we talk about how accurate is that diagnosis. We talk about who does that diagnosis accurate, using different tools, X-ray, lab, certain pharmacological tests. So the first domain is accuracy. Second domain is timeliness. If you remember in my Rahaf case, I was late by 3 days, which got her a bit sick. So timeliness is another important domain in accuracy, in diagnostic safety. Because if you do a test that is late, it might be useless at that time. The third part is communication. So if you do a test at the right time, but you don't communicate it well, then might be it's too late or it's not helping the patient. So the 3 important parts of the patient or the diagnostic safety are accuracy, timeliness, and communication. Going further, do we have a problem? Let me ask you all. Do we have a problem of diagnostic safety in Saudi? Who thinks yes, please raise your hand. Okay. For the rest of you who does not think so, let's see the numbers. The Institute of Medicine are saying we have 12 million adult patients are affected by that. We have 10% of hospital-related death related to diagnostic accuracy, 6 to 7% of hospital diverse event. That is international. The Patient Safety Center, the Saudi Patient Safety Center, reported that 15 to 20% of adverse side effect can be prevented because of diagnostic accuracy. In Saudi, there is a study in Al-Madina, in Taiba University, 30 to 40% of medical malpractices claims are because of diagnostic accuracy. 20 to 25% of diagnostic delay in cancer patients. And again, this goes back to the timeliness. 20% of all adverse emergency department events are happening because of delayed diagnosis. So we have it in the country. It's huge. So 11% of medical errors, again, this is a big study, is because of diagnostic accuracy. So who's next? I would say 1 out of every 5 patients you're seeing a possibility of having a medical diagnostic error. So this is how important is this problem. This is how impactful. It's very important. It's happening. It's 1 in every 5. It affected my own daughter. I have affected my own daughter. So keep that in mind. 1 in every 5, a good chance he will be affected by your diagnostic error. Now, why it's happening? So we asked the first part, which is what? Now let's talk about why. Let's start with this. Who thinks system errors are the problem? I think everyone agrees. The experts would say system error is the problem. And yes, indeed, it is. Many things in the system. I was talking with Dr. Ali a while ago that we are pushing our teams, we are pushing our nurses, our physicians on the edge. We give them extra time, overtime, understaff. This is a system issue. You cannot blame people for that. But this is a very important thing of why this is happening. So system issues is number 1. The high pressure is the second part. If you work in a high pressure situation, emergency department, obstetric and gynecology, operating theater, intensive care, especially if you are understaffed. This is a huge factor that will affect your diagnostic safety. And definitely, I cannot just blame the system all the time. There has to be some cognitive issue. Some of us are not up to the level, up to the appropriate knowledge. The competency is not as good, so we need to take part. We need to take an ownership in that part. So there is a piece of ownership in the diagnostic accuracy that is owned by the physicians, by the nurses, by all the healthcare providers. So the system is number one, the high pressure in the systems, and the cognitive issue. Now, why not? We should not have issues that are related to diagnostic accuracy. I'm sure that you want to improve trust. I'm sure that many of you, if we ask you, would you go to hospital X? He would tell you, no, I would never do that. And I don't want to name certain hospitals or sectors. I'm very positive if you tell somebody, let's go and see, even for simple flu, let's go and get seen in hospital X. He would never do that. Why? Because of the word of the mouth, because of trust. So why not to be affected by that? First is the trust. We need to improve the trust. The second part, which is why we're here, is to improve our patient outcomes. With errors, we will not have good outcomes. Again, going to my own child, I got her to be in a DKA. She was admitted to the ICU for 2 days. If I could have done that earlier, I could have saved her the ICU admission. So this is another thing, improve outcome. And the very first rule of medicine, do no harm. So we need to remember that. So that's to summarize why we should do it. Now, what to do? Now, this should come as, as an animation. However, this is the triangle that we should tackle. And again, it's the system. This is the base of the triangle. If you don't tackle that piece and work on the individuals, you will not have a base to build on. We need to work on our systems. There are different tools in the system provided by the Saudi Patient Safety Center, by the WHO, by other organizations like the safety culture and other tools. We should start by the system. We should have a system of trust, a system of reporting, anonymous reporting. All of these are important things to build in the system. Now, with the teams, we're talking about intra-teams and inter-teams. So intra-teams, we are in an emergency department. I'm the consultant, I have a resident, I have a nurse, I have a respiratory therapist. We have to improve the communication among these 4 or 5 pieces. We need to talk to each other. Now, this whole team should talk to the other team, which is, for example, the laboratory team. If you're not talking to the laboratory team in the appropriate way, you will be losing things. So intra-team we need to work, inter-team we need to work. There are different, again, ways of doing it, like team steps, other training things that help you to improve the communication. This is very important. And the last thing is individuals. Now, individuals, I would say it has 2 parts. The individual self himself, the knowledge, the improvement of the knowledge, the training, attending these conferences, knowing more is very important, and as well, holding accountability to patient safety. I need to hold accountability that I'm accountable for patient safety, start reporting, talking to people, communicating well. Does it stop all here? No, it does not. We'll tell you where it stops. With the feedback. The system should feedback the individual, and the individual should feedback the system, and so on and so forth. It's an ongoing process. We need to talk. The individuals, you guys need to talk and escalate to the system. The system should empower you and should improve more and more. Now, just to summarize, remember, 1 of 5 of your patients, of your loved one maybe, might be affected by diagnostic inaccuracy. We're talking about the 3 lines of our diagnostic accuracy, which is accuracy, timeliness, and communication. The 3 reasons that we have to tackle to fix diagnostic accuracy are system errors, high pressure, cognitive errors, and to improve it and fix it, we're working on systems in the beginning, and this is the base. We're working on teams, intra and inter teams. We're talking on individuals. You're talking about his patient safety advocacy and the knowledge improvement and the ongoing circle. Rahaf now is a diabetic. She's compliant with her medication. She's 16 years old and almost done with her secondary school. Thank you.